There's a renewed push for reforms to our state's mental health systems after a couple was allegedly killed at the hands of their own son.
Sean Rice talked to stakeholders across the mental health care system. And Sean, the prevailing message is the system failed these parents who had reported issues before, right?
There's pretty much agreement across everyone I spoke with that this is a completely failed family. Our system did not take their son into account, his problems and what he was facing. Lawmakers, civil defense attorneys, and family advocates, they all agree Scott and Tina Turk, this couple, should not have lost the lives at their hands of the son, 29-year-old Jonathan Turk. They tried several times to sound the alarm on the signs that their son needed help, but Arizona's mental health system was woefully underprepared to give him the help he needed.
Honestly, not surprised.
Sad, but not surprised.
These are the reactions to learning these Peoria parents were taken at the hands of their child.
We have counted 15, and this will make it 17 caregiver homicides, parent homicides in the last 5 years in Arizona. The fact is that we are asking parents and caregivers to take care of people who should be in psychiatric hospitals.
Rachel Strife, co-founder of Arizona Mad Mom, says parents all across the valley know their children are dangerous, but she says there's no beds available to house them, medicate them, and ensure they are not in a position to harm others. And even when people are committed to a hospital for treatment, she says their stay is often short.
There is heavy pressure to discharge patients home to families or back out to the community, even though we don't know if the medication works, even though they're not stable, even though we don't know if the side effects are going to be treated and if they have a continuum of care that awaits them after discharge. The system is just so broken.
We know that Scott and Lisa Turk filed several mental health petitions on their son. What we don't know is what happened with these petitions. Was he committed to a hospital and court ordered to take medication? It's not clear because medical records are not public record.
You need clear and convincing evidence that the person is a danger to themselves or to others.
Those arguments are often made in Maricopa County Mental Health Court. Do you find that if an evaluation is done on somebody who had a petition filed on them and they blanketly claim, I don't feel I'm a danger to myself and I don't feel I'm a danger to others, that you're not likely going to get a court order then?
Yes, if the person can prove that they're not a danger to themselves or others, the judge is likely to grant the petition in favor of the person who's fighting it.
Republican Senator Hildy Angus of Mojave County has proposed legislation to expand the numbers of beds available for use and to create a program that provides long-term care for people suffering from serious mental illnesses.
We just can't kick it down anymore. When's the next? Because, now we know the problem. And if somebody dies again, like this poor couple, the blood's on our hand because we know it's going to happen.
Jonathan Turk, he's going to cost our state millions of dollars, not to mention the tragedy of losing two just wonderful individuals because of his untreated illness. Imagine if we had systems in place to prevent this, to act early, and the capacity and the funded system to do it.
And both Rachel and Hildy tell me without these programs in place, there is a pattern, a documented pattern of these people with serious mental health illnesses committing crimes or ending up in jail or prison. And if they aren't, they're adults living with their parents, and those parents are forced to provide them with care. In cases like this one, those alternatives can turn deadly.
Yeah, just devastating and complicated all at the same time. All right, Sean, thank you.